depending on which time zone you're joining from. So I would like to welcome you to the APPNA MERIT webinars. And APPNA is, as you all know by now, is the Association of Pakistani Physicians of North America. And then the MERIT subcommittee is the Medical Education, Research, International Training, and Transfer of Technology. So under this subcommittee, we've been holding webinars every 2 weeks where we are bringing experts in clinical research and technology from both sides of the ocean, from US and Canada, and also from Pakistan to share their experiences, provide a platform so that the knowledge base is there, and then that will facilitate collaboration and provide an impetus for doing clinical research and transfer of technology. So we've been successfully holding these webinars for now 3 years. Just a quick reminder is that this will be the last webinar of this year. And now we will break for the APPNA Winter conference that is going to be happening in Sindh, in Karachi and Hyderabad. So, and then we will restart next year. And there will be a sort of a white paper where we will compose the major findings from these 3 years and publish them. In addition, all of these webinars are available on YouTube, on the APPNA MERIT channel, and also on the WhatsApp group. So if you have not joined the WhatsApp group, please do so. It's the digital library where we will put the link in the chat so you can join that, where we have a lot of research resources, and all of these talks are also posted there. With that, I'm your moderator, and people who regularly join us know the moderator and the panelists. So my name is Sarfraz Hasni. I'm a clinical researcher, physician scientist, and a rheumatologist at the National Institutes of Health in Bethesda, Maryland, in USA. And the panelists are Dr. Javeen, Dr. Saeed Uzair, and Dr. Akhtar Hamid, who will provide their comments at the end. In addition to that, there is a lot of excitement about this webinar. So I'm sure there will be a lot of question and answers. So if you look at your screen, at the bottom part of the screen, there's a Q&A tab. So please put down your question and answers in that, and we will try to get to them as much as possible. So with that, it's my honor and pleasure to introduce today's speaker is Dr. FAROOQ Azam Rathore, who has spoken to us before, and we've asked him to come back. He will be talking about the using AI tools to improve healthcare delivery in Pakistan. Dr. FAROOQ Rathore is a professor and consultant in rehab medicine and pain specialist at the Armed Forces Institute of Rehab Medicine, Rawalpindi, Pakistan. But he was just telling us that he has since moved to Quetta, and then there may be some issues with the internet. Bandwidth may not be there. So if there is some connectivity issue, just bear with us. We will rejoin if there is a problem as soon as possible. So there is a long intro, and I'm sure you're all waiting to hear from him. And the intro is available on the website for you to read more about him. But he has delivered over 130 workshops in medical writing using AI tools and research, scientific misconduct, research ethics, evidence-based medicine, and presentation skills around the world. He's also the co-editor and the current of GISR SPRM and the current chair of the Disaster Rehab Committee of PRM, which is the International Society of Physical Medicine and Rehab. He has over 250 publications and more than 4,300 citations. So with that brief intro, I would like to request Dr. FAROOQ Azam Rathore to please inform us about the using AI tools to improve the healthcare delivery in Pakistan. And again, thank you so much, Dr. FAROOQ. I know that you're very busy, so taking time out of your busy schedule, I appreciate it. Please take it away. Thank you so much.
Thank you, Dr. Sarfraz, and welcome to all participants. Always a pleasure to talk to my colleagues from APPNA platform. So today's topic is how to use AI tools to improve AI health delivery in Pakistan. So I'm going to start with a story, right? So Talha is a resident, and just like most of the residents in Pakistan nowadays, he was doing his ward rounds. And after the ward round, he had some queries went online, probably consulted Medline or maybe Up to Date. While he was consulting this, his professor walked in and he saw this young man standing in the middle of the ward, glued to the screen of his mobile phone. And he sort of like started scolding him. Why are you wasting your time? What are you doing? And obviously, Talha tried to explain that I'm going to do a literature search in order to get an answer to the question that I just saw for my patient. And you know what this old school professor like myself probably said? He said, in my old days, when we did not have this internet or YouTube, the doctors did not rely on technology for literature search. What we used to do, we used to go to the library, search for the relevant journal, scan it cover to cover to locate the article that we wanted to read. Now, honestly speaking, my residency started before YouTube was launched. I never had these kind of tools at my disposal. I never went online on YouTube, or I did not have access to Up to Date on my smartphone because there were no smartphone in my time. But how many of you would say whether this person was right or wrong? So there are three options. How do you feel about this statement that why are you using the smartphone and why don't you go to a library and do a literature search? Three options, 1, 2, and 3. Simply type 1, 2, or 3 in the chat box. He's right, he's wrong, or maybe plainly Baba Satya gaya. So what do you think? What is your comment on this? He's right, okay. Okay. Okay, so some of you are sort of like saying that he was right. Some say he's plain wrong, and some are saying Baba Satya gaya. If you ask me, honestly speaking, I think he is wrong. Now, why he's wrong? You need to understand that change is inevitable, growth is optional. Each one of us in the last 10, 15, 20, 30, 40, 50 years has grown up. We are now using technology at a larger scale. And no one can deny that technology like internet, maybe electricity, the transportation that you use, nobody can turn the clock back. And we need to understand that these AI tools are a similar kind of disruptive technology that are now part of our daily lives. Yes, I also went to my library in order to search for articles, but you don't expect people nowadays to go out and maybe travel a couple of kilometers and then scan a journal from one end to another end. It is not efficient, it is not effective. You have to use these tools. You have to change with the changing world. The second story is that of Aisha. Aisha is also a resident or maybe a senior house officer. In the middle of the night, when she's all alone, she's faced with a difficult case. Unfortunately, like most of the people that in Pakistan are, she's unable to ring up her consultant because she knows she's going to get this kind of answer. तुम्हें ये भी नहीं आता और maybe तुम्हें मुझे इसलिए जगाया है. What should Aisha do? Or what can these so-called AI tools do in order to help Aisha to deliver a high quality healthcare service right in the middle of the night to her patient? So this is what we are going to discuss today, that how you can smartly, ethically, transparently use these artificial intelligence tools to improve healthcare delivery in Pakistan, which is a lower middle income country. And as usual, a couple of disclaimers I need to disclose. My background is from rehabilitation medicine, rheumatology, pain medicine, and bioethics, which means I'm not an expert of other subjects. I may make mistakes. I'm sorry for that. So please do correct me. This is going to be a bilingual presentation because most of my audience I know are from Pakistan और दिल की कुछ बातें अपनी जुबान में ही बेहतर कही जा सकती हैं. Before I talk of this thing, let me say it very clearly and openly. AI tools cannot replace a physician's expertise and in-person consultation. You need to be very clear about that. And I'm going to state the bitter facts and the ground realities because I have worked in Pakistan in different capacities, in different cities, and I know how the system works in my country. And I am particularly aware of the healthcare system in which we are talking about AI tools, but we have OPDs overflowing with patients. When we talk of AI tools, most of the research that is available online comes from the West, Europe, Australia, Japan, China. They have a very well-developed healthcare system. I'm talking about this kind of Pakistan, which is faced by most of the patients in public health sector. I'm talking of this Pakistan where people with IV lines, hydrotropic supports are actually put in the wards without any concern for cardiac monitoring. I'm talking of this Pakistan where we have to talk to our patients' attendants who cannot even talk in Urdu. What to talk about that fancy English language in usually with doctors communicate? And what about the patient education material? What about how to counsel the patient? How we are going to do that? And if I'm unable to do that, can these AI tools change my paradigm? Can they help me improve my patient communication skills? And this is what we're going to talk about. And I'm also very well aware of the challenges, the technical support in the work environment available to majority of the healthcare professionals in Pakistan. There are really good centers out there in Pakistan, fantastic. We should emulate them. But I know what happens in most of the healthcare centers in Pakistan. For example, these AI tools work on a stable internet. And we are working in a country where you're not very sure that whether VPN is halal or haram. You're not going to get internet. And if you try to access internet through VPN, it's haram. So if someone is on VPN, I request you, please go back, disconnect your VPN and come back again. Because I was told this is a certified halal webinar, right? And then we have our best friend, the shark, who lives in the Arabian Sea and often, takes a bite on our internet cable for lunch or dinner. So we are talking of AI tools in this kind of paradigm. देखें, तल हकीकतें बदल नहीं जाती अगर अपनी आंखें बंद कर लें, ये याद रखें. So you have to analyze all these things and then you have to come up with solution working in the same constrained environment. So please go online, please do a good literature search and see how AI tools are revolutionizing the medical healthcare system around the world. But then come back again and place your feet on the same ground where you're working in Pakistan with this kind of shark and VPNs, right? So first of all, I would like to ask you a question. Whenever we say healthcare delivery, I mean, what does this word mean? And what are the different components or facets of healthcare delivery? So if you can please quickly write down in the chat box, different facets of healthcare delivery. I'll wait for a minute and I would like to see your answers first, because please remember, unless you don't understand the terminologies and you're not on the same page, you cannot move forward as an instructor and as a listener. HR, excellent. Resources, HMIS, healthcare providers. Anything else? Thank you. Come on, you're more than 100. Yeah. Primary health is very important and very neglected in Pakistan. Medical technology, information system. Yes, tertiary healthcare system, or what we call the specialized care. Excellent. Information system. Delivery of services, health force, primary, secondary, tertiary. Fantastic. Telemedicine. Thank you, Dr. Kiran. Excellent. Community health, secondary healthcare, fantastic. Let's move forward. Let's move forward. So you need to understand that healthcare delivery has many facets and many components. For example, it includes number one, preventive. I mean, you would like to prevent a certain disease before it happens, like in case of poliomyelitis, right? Or maybe some communicable disease or infectious disease. And we need to talk about primary healthcare services, which are unfortunately not very well developed in context of Pakistan. Then there are emergency services, right? It's also a separate and completely different facet of healthcare delivery, which differs from preventive and primary healthcare. And then you have specialized secondary or tertiary healthcare services. Then you have rehabilitation services for those who have sustained a permanent or maybe a transient disability. Mental health services are a totally different facet, which are delivered in a different kind of manner. Then you have patient education, which is unfortunately in most of the cases, not all, in most of the cases neglected in Pakistan because of many reasons. We don't have time. I mean, if I have to see 100 patients in 6 hours, please don't expect me to give like 30 minutes to each patient. I'm really sorry. I'm very blunt, but I can't do that. And if you want me to talk to them and give them some patient education material, I mean, come on, guys, it's impossible. And even if I am able to download something from the internet in English language, my patient cannot even talk in Urdu. What to talk about that fancy English brochure from USA or something else? It's not going to work in Pakistan. Then diagnostics. And for diagnostic, I particularly means our colleagues working in pathology and our colleagues working in radiology services. A huge service, right? And obviously, healthcare administration or sometimes overlooks and coordinates all these services. So So you need to understand that healthcare delivery is not a singular concept. It's a very complex and a huge broad concept. And it's impossible to cover all aspects in a 1 hour webinar. So I'm going to touch upon few of them which I think are more relevant and which are at the forefront of healthcare delivery in Pakistan. And then we are going to discuss how it smartly and ethically integrating these AI tools might make a difference in the physician's life, make his or her life easier, and might improve the healthcare outcome in our patients as well. And again, before we start, it's a very, very common question that people often ask on discussion boards, WhatsApp groups, that, since now AI tools are here, will AI replace physicians or healthcare professionals? The short answer is no. Yes, there are going to be job displacements. Let's be very honest about that. And as they say, the specialties which are going to be affected the most are again diagnostics, because now AI tools have the ability to scan millions of X-rays, MRIs, and predict certain things much better way than a physician. This is the reality. An AI tool can actually scan millions of results of a histopathology slide and can pick up which slide is going to show up a cancer cell. Now, these are some realities. But when we talk in journal of healthcare delivery, we are talking of a healthcare professional interacting with a patient. And let me tell you, if the healthcare professionals in journal, and particularly in Pakistan, they keep on giving their time to the patient and they do the time-tested principles of healthcare delivery, which includes an eye contact with the patient, listening to the patient, showing a certain amount of empathy to the patient, touching the patient, which means a clinical examination instead of only relying on X-rays and laboratory, and then maybe listening to the patient about their concerns instead of teaching them how much medical knowledge that you have. Hopefully, inshallah, AI tool or any other thing or technology is not going to replace those kind of physician and healthcare professionals. But if you are someone who does not listen to the patient, who is totally focused on the screen, who is not even performing a clinical examination, then please remember, not every patient who has a smartphone is directly 24/7 connected to Dr. Google. And none of you, even if he has 5 MDs and 5 FCPS, can even compete with Dr. Google or with any LLM because of the vast amount of knowledge on which they are trained. So please remember, if you are a physician who people want to visit because he is a humane physician, no technology tool is going to replace you. But if not, if that's not the case, then you might want to revisit your strategy. Now, what are the application of generative AI in healthcare system? Now, there are many applications that are clearly documented in literature. But again, as I just told you, most of the literature is coming from the developed world, high-income countries who have a stable internet, who have a good technological structure, a very good infrastructure to support integration of AI tools, where people are cognizant of the fact that how AI tool can actually help them. And they are very open to invest in AI tools, right? So AI tools have been used in clinical medicine to discover new drug molecules. Recently, I got to know it was an amazing thing. So those of you who are physician researchers or who are into research, AI tools are able to even generate data. I'm not saying, you can't say fake data, but training data. So it trains on a certain amount of data, and then it generates a new set of data that physicians or researchers can use in order to train themselves or to get certain insight into certain disease. Then these AI tools have been used for clinical decision making. I'm going to demonstrate certain of these tools later on at the end of the webinar, but just to let you know that these AI tools have multiple applications across the globe, and they have been used successfully in many countries around the world. But I'm going to show you a couple of examples from the published research, primarily from the low middle income countries and specifically from Southeast Asia, Nepal, India, Bangladesh, and Vietnam. So, for example, malaria is a major concern still in countries, many countries in Africa. And we have some standard diagnostic tools, but again, sometimes because of lack of resources, sometimes the specialist who is able to detect this malaria parasite is not available. The slides might not be of high quality, and there are so many things related to a human being interpreting this that mistakes can be made. and diagnosis might be delayed. And in case of malaria, if that malaria converts into a cerebral malaria or a complicated malaria, it means you can actually lose the patient. So these AI tools based on the deep learning model have been used to successfully enhance the detection of malarial parasite in slides in Kenya, Uganda, and other African countries. A success story in malaria coming from a developing country. Then this is another study that was published from Vietnam. So what they did was they actually used this AI tool and integrated them with gene expert, and they called this double X strategy, using an AI tool and then gene expert in order to detect pulmonary tuberculosis, including latent and early pulmonary tuberculosis. Although in the end, they recommended that they need more studies to further validate their finding in large cohorts, but the results were amazing. They were able to pick up those latent cases which were being missed on routine X-rays. So again, it is a revolutionary tool that has been successfully used in detection of pulmonary tuberculosis. That is also an issue being faced in a developing country like Pakistan. Diabetic retinopathy. So unfortunately, because when you work in a large country like Pakistan, you can't provide quality services for management of diabetes to everyone, which means many patients are going to end up with complication like diabetic retinopathy. And if there's an ophthalmologist sitting in, among our attendees, they would agree with me that diabetic retinopathy is a major issue. And unfortunately, because in Pakistan, patients do not come to their doctor at an early stage, you lose eyesight because of diabetic retinopathy. Now, using different deep learning techniques and different techniques related to AI tools, people are enhancing early detection of diabetic retinopathy in high-risk population. Just imagine if you're able to detect only 10 to 20% of those patients who are at high risk, how much lives and sight you're going to save. Food for thought. Again, this is another study that was published from Nigeria, an African country, in which they compared tuberculosis system screening of chest X-ray with artificial intelligence tool in an active campaign. And the result was that integrating artificial intelligence tool to the usual tool enhances the diagnostic accuracy. Food for thought. Now, macrosomia is a disease in which the baby is large. And when the baby is large, it can result in obstructed labor and certain other complications both for the mother and for the fetus. So this machine learning study was carried out in Bangladesh. Bangladesh is doing a lot of work on integrating AI tools in maternal and child health and on telemedicine. So this was a study that was carried out using machine learning tools, and they predicted the macrosomia in high-risk mothers, which means they were able to intervene early before the labor set in. And obviously, they saved a lot of mothers on the way. Again, food for thought. Then again, there are so many different kinds of AI tools, and I'm not going to go in the technical details because it's beyond the scope of this webinar, and I want to focus more on the some active principles that you can actually integrate right from now. So convolutional neural network, CNN. So this is again a different kind of AI network that you use in order to detect certain things on radiological scans. And this was successfully used to detect pneumonia. This study was published from China. As you can see, this was a very interesting study. I liked it because I do see a lot of patients with stroke. And unfortunately, for most of the patients with stroke, at least in developing countries like Pakistan, is that most of them can be saved, but they lose the golden hour. They reach the hospital after many hours, and in some cases, even after many days, because doctors, there's no access to specialist doctor. They are unable to do a CT scan. If the CT scan is done, there is no radiologist to interpret that CT scan. So this was a study that was carried out in a city in India, in which they used an AI tools which was integrated with their CT scan machine to interpret and accelerate the treatment of acute stroke in rural India. And just look at the impact of this small study in a city in India. Number one, this AI was able to quickly and accurately analyze these head CT scans, and they were able to effectively identify the strokes, hemorrhagic or maybe ischemic, and rule out hemorrhages with high precision. And the most important thing was there was no neurologist available there. There was no trained radiologist available there. It was all done through telemedicine. And they were able to integrate that AI tool in their CT scan machine, and they were able to ask their radiologist sitting hundreds of kilometers apart that what is the diagnosis. And that was first the AI gave a diagnosis, the radiologist confirmed it, and it actually empowered the non-specialist to take the next step. And ultimately, it resulted in 187% increase in early intervention. Because if you are able to diagnose a disease in the early phase, a disease like stroke, obviously you're going to intervene early, and that would actually reduce time to treatment and ultimately improve the diagnostic accuracy. So things are being done even in this region with low resource settings. So this should give you a food for thought, whether your background is from neurology, pulmonology, rheumatology, pediatrics, maternal health, whatever, you might want to explore these tools and then integrate them into your practice as well. So once we talk of a Pakistani context, again, this article was published in Dawn couple of last year, and this gives us hope. Why? It says there is an estimated 95% of households in Pakistan have at least one mobile. And I would like to ask you a question. Pause for a moment. Just think of your family members. How many family members in your vicinity who are more than 18 years of age do not have a smartphone? Every household has a smartphone. Even young children have a smartphone. And these smartphones are actually fully functional laptops, computers. They can collect data, they can send out data, and you can smartly use these devices which are already in the pocket of your patient in order to collect very valuable data that can be used to create larger data sets. So think of it. Then when I went online to see what is being done in Pakistan, so I was happy to see that the National Center of Artificial Intelligence, which is based in National University of Science and Technology, NUST H11 Islamabad, is doing a lot of work. So this was an article that was published in PFMJ in 2023. I'm not going to bore you with details, but as you can see, people in Pakistan are already working on pulmonary diagnostics, early detection of breast cancer using AI tools, early detection of brain tumors, very important, right? And in general, enhanced diagnostics using AI tools, cardiac monitoring, cardiac devices, neuropathy, and so many things. So a lot of things are being done in Pakistan. This is a very interesting concept paper that was published just like 4 or 5 months ago. This is basically a sort of an algorithm, you can say, known as Darchini. I love the name because Darchini is a local word. If you want to connect to people, आपको अपनी ज़बान में बात करनी पड़ेगी. I am totally not against in talking or communicating English language. Our every textbook is in English language. But आपका मरीज इंग्लिश नहीं समझता, उससे बात करनी है, उसके लेवल पे आना पड़ेगा, उसकी जुबान में बात करनी पड़ेगी. So Darchini is a very like a traditional word, right? So Darchini is an algorithm or it's a program that they have launched. It's an initial phase which is hopefully going to improve not only diagnostics but also the delivery of healthcare system in Pakistan. It is still in infantile phase, and I really hope, I wish, I pray that this system improves. And if someone is interested, this article is available online. I can give you a link as well. The surprising thing that I found during my literature search was, as you guys can see from this as well, most or almost everything with AI tools in diagnostics, in healthcare, is mostly done by non-medical people. So probably this is a window of opportunity for youngsters who are very tech savvy, who have a lot of information, knowledge, and they use these AI tools and these computer and laptops on a regular basis, much more than people like me. So probably you might want to collaborate with these non-medical people and give them direction. And this is going to be a fantastic collaboration between a healthcare professional and these people with a background in computer science and AI tools. And hopefully you're going to do really something good for this country. I really wish. Please do that. But before we get hyper excited, you need to understand there are certain concerns with the use of AI in healthcare delivery. And these are very valid concerns. Number one is data related. These AI tools collect a large amount of data, and data leaks are a very bitter reality, right? So what about data privacy and security? And that's why some people, patients, are not very comfortable in giving out their sensitive data to other people, right? And then bias and fairness, because most of the data on which these AI tools are trained, unfortunately, comes from the West. So our context is different, our diseases are different, and once you try to interact with these AI tools, there comes the problem with bias and fairness. And unfortunately, in many cases, there's no availability of data on that particular thing. So wherever you try to launch an AI tool in a particular healthcare system, you need to have data. And you and me, we all know that at least in the public sector hospitals in Pakistan, how do we collect data? Are our medical records accurate? Do we have an EMR system? Unfortunately, no. Then there are certain ethical concerns. The first ethical concern is about transparency and explainability. Please remember, although these AI tools they've expanded a lot and they've improved a lot, they are still black boxes. Even computer scientists and AI scientists working on them are not very clear. How do they reach a particular diagnosis, or how do they reach a particular decision? It's a black box, right? So you and me might ask the same question, but might get different answers. Then responsibility. Who is going to be responsible if a person dies or gets injured as a result of a decision made by AI tool? Is the AI company responsible? The physician who makes that prompt responsible? Or the nurse who gives that treatment is responsible? So this is a major ethical concern. Who is going to be held responsible? And then job displacement again is a major concern, that people are concerned that at least this is going to shape the healthcare scenario as we see today. And it is a concern. And obviously, whenever a human being gets displaced, it becomes an ethical concern. The technical concern are again reliability and safety of these tools. Are they reliable? Can you blindly rely on them? The answer is no. Then integration challenges and cost. So obviously, even in Pakistan, let's say the government says integrate AI tools. We all know that certain high quality private setups are going to integrate these AI tools much before than our public sector. I'm sorry, but this is how real life is. It is a large cost. You need to have a very good IT department. You need to have very good tech support. And then unfortunately, many people think for the right reason that if our youngsters, they simply start relying on these AI tools and they don't use their own minds, their own memory, their own clinical acumen and clinical examination, unfortunately, this over-reliance can negatively affect the healthcare delivery system in Pakistan and other developing countries, which is important to consider. Social concern, equitable access. AI tools are costly. They are going to be accessible not only to everyone in Pakistan, they're going to be accessible only to those who are going to afford them. So yes, this is a major issue of equitability. Then you have to build a public trust. People are already fed up with many healthcare professionals that they're more glued to their screens. And if they have got AI tools and the person is not looking at the patient, instead he or she is only focused on the screen for the AI tool, unfortunately, building of public trust is going to get hampered. And then people say there's so much technology available right now. It's much more than what was available 10, 20, 30 years back when doctors used to have a stethoscope, they used to touch the patient, do the physical examination. So if you bring in these AI tools, it's going to dehumanize the care of healthcare delivery. It's a debatable topic, but I feel there is some substance to this claim that if we become over-reliant and we simply become a technological tool and a mechanical robot, so probably this thing holds true. Now, I'll quickly take 10 minutes to demonstrate certain things because I feel, at the end of the day, I'm going to go back to Aisha, the young house officer who was sitting in the ward in the middle of the night, and he was unable to get any good, high quality guidance. So if you don't improve your primary healthcare, if you don't support your house officers, if you don't support your young residents, I'm really sorry, even if your professor knows how to use an AI tool, it's not going to make much of a difference, because the frontline warriors or workers are our house officers, our residents, our nurses, and the staff that remains in the ward for most of the time. So before I start with the demonstration, please let me know how many of you have used the speech to text feature in ChatGPT that is available on your mobiles. Number one, I use it all the time. I use it sometime. I have not used it. What is this feature? So if you can answer this, 1, 2, 3, 4. Okay, 3, 4, 3, 4, 3, 4, 3, 4. Some two. So mostly 3, 4, and some of you say 2. That's fine. I mean, it's unfortunately understandable. It has been more than 2 years since ChatGPT was launched, but still, people mean like professionals, healthcare professionals, doctors, people working in healthcare system are not making the best use of these tools. So let me demonstrate what does this mean. Just give me a second. Okay. Just give me a second. So just give me a second. I'm going to connect my screen, and I would demonstrate something that I feel is very, very important. Just give me a second. I got disconnected again. Also working in Pakistan, this is how life is. So don't get worried. Lost connection. Trying to reconnect. Yep. Just give me a second. If it doesn't matter, work within a minute, so I'm going to move forward with it. Yeah. Connect. Come on, come on. जब तक I wanted to demonstrate that, you know, instead of wherever you are on the go, for example, you are seeing patients, or maybe you are working in your ward, you're busy, you don't have access to a laptop, you don't have access to a computer, you don't have time to type in everything. You guys should actually use this feature of ChatGPT, which is available in your Android or iPhone. There's a small icon of this microphone, and you start talking in it, and it actually transcribes whatever you say, and it becomes very easy for you to have a consultation or have a chat with ChatGPT while on the go. So again, it's a feature, but again, that's not available. So I'm going to demonstrate something else. So let's assume, okay. Can you guys see my screen?
No,
Can you see?
FAROOQ, nothing. We're not able to see screen.
अच्छा, इसमें आपको मेरे चैट जीपीटी स्क्रीन नजर नहीं आ रही?
No,
Okay, give me a second. Give me a second. I need
we
to.
can see you.
Yeah,
So,
नहीं, मेरा दिख रहा important नहीं है. Yep. Just give me a second.
okay.
Yep. Now, can you guys see this chat GPT screen?
Now we can see it.
Oh, thank you.
Yes.
Okay, sir. Oh, yeah. Sorry. I have to do something else again. Just give me a second. And now, can you guys see my Word file, blank Word file?
Yeah, we can
Yes.
see the blank Word document here.
Okay. So, okay, well, thank you very much. So again, assume that you are a resident, you are working in ER, and just I'm doing for your ease, but assume you are doing it on ChatGPT, this mobile phone, right? So there's an option known as dictate, and just let me demonstrate. I am a resident working in the emergency department. I am seeing a 45 years old male patient who presented with 6-hour duration of severe epigastric pain associated with bilious vomiting, 3 episode. He has slight fever of 100 degree. His lab show slightly increased TLC. There is severe tenderness on in the epigastrium. I want you to give me a differential diagnosis. Give me 3 common and 2 uncommon diagnoses. This should be in the table form. I would also like you to give me a list of 5 very important investigations that I must do. Justify your investigations. Stop dictation. So imagine you just talk to your chat GPT and you put everything here and you give it a command. You're all alone. But the good thing is, if you try to understand, you are not doing it you're not simply talking to your chat GPT. You have examined your patient, you have examined his labs, and now you want sort of a guidance that you might be asking any of your seniors. So you do like this. Again, it's a bit slow. Yeah. So what I'm going to do is I'm going to share this in the chat box. So you guys can simply review it in the next 2 minutes, and then I'm going to move forward. So look at this. And this is a very simple example. You can make it as complex as you might want. For example, you might want to say, so it gives you a differential diagnosis for severe epigastric pain vomiting. On the top is acute pancreatitis and peptic ulcer disease with perforation inflammation. You might want to ask that how would you differentiate between acute pancreatitis and duodenal perforation. And within seconds, it gives you a comparison table. Now, this is a very good starting point for someone to start off. And it all started with taking a detailed history, performing clinical examination, and then reviewing the investigation. Now, this is a sort of a cooperation between a human input and an AI tool help. So no one is saying you to totally rely on AI tool, but what I'm telling you is that by smartly using this AI tool in difficult and different situations, you can actually come up with things like these, right? I have made a couple of other scenarios which I'm going to show because we are short of time. So look at this. For example, what about this? So you are an ER resident and you see a patient, 45 years old, elevated D dimers, but no obvious signs or symptom of pulmonary embolism. You are asking that ChatGPT, someone, I need your assistance in walking through this case. Can you guide me what questions should be asking myself and what information I need to gather to effectively assess and manage the patient? So again, I'm going to share this. And this is how it's sort of a continuous learning process that has been enhanced by the smart and ethical and transparent use of AI tools. And this is the healthcare delivery that is being provided by thousands of doctors across the country each night. And unfortunately, many of them do not get the help they're seeking. Sometimes they do not get the answer. Sometimes they're unable to ask their seniors, and the result is disastrous. Again, this is the second chat that I'm going to share with you. And again, you can move on with this chat. This is the question that ChatGPT is directing you. You might want to take a patient history. You might want to take a physical examination. Now, these are the laboratory investigations that you might to do. And look at this. These are the pointers in the clinical history. These are the comorbid condition. Identify any condition that may confound the presentation, heart failure, COPD, stuff like that. And you might want to say, can you look at this? Can you tell me more about these? So again, what I told you in the previous presentation, it's a two-way interaction between the person using the tool and the tool. The better the interaction, the better answers you're going to get. For this, you have to improve your skills of prompt engineering. So just look at this. Again, it's going to give you a lot of information which you can assimilate, you can sort of read, and then you can decide whether it is of use or not. Another use I'm going to demonstrate again because we are a bit short of time. Look at this. So this is another tool which is known as Mistral. I hope you guys can see this. Ali Imran, yes, this is good. Even if your senior professor and physician don't know the use of AI in ChatGPT, honestly, they are not available in the middle of the night. In the middle of the night, there's going to be only one HO or only one resident who will be looking right and left for guidance. Yes, I know people go online on Google, but Google cannot tell you answers in this format. It cannot have a debate with you. You can't ask these kind of chatting questions with Google. So you ask these questions to your ChatGPT, and it's going to answer you. So look at this. Please click this this chat link on Mistral. So imagine this. I have given this a patient comes to me in OPD. I'm not very sure that what kind of lesion this patient has. So you take a small picture, you upload this picture in any LLM, large language model. I have, just for the sake of discussion, I have used Mistral, and look at my question. act as a dermatologist and explain this skin lesion to me. What can be the possible differential diagnosis? And look at this. First of all, it explains what the lesion is. Lesion appears to be raised, pink to reddish growth with a slightly irregular surface. And because it's a large language model, it says, while I cannot provide a definite diagnosis, I can offer possible some DDs, BCC, SCC, actinic keratosis, keratocanthoma, seborrheic, and then you can move forward this discussion that what is the possible reason that you labeled it is a carcinoma, what are the different types, what should I do, and stuff like that. So, simply taking a picture and uploading that picture to the LLM can give you a lot of answers. You need to understand this is the change that is already here. In my days, I could not even imagine of having a mobile phone with a camera. You guys have a mobile phone with the high resolution cameras. So, I mean, instead of taking the selfies all the time, why don't you smartly use this technology tool in order to enhance your own learning, your own skills, so that the healthcare delivery in Pakistan that is being delivered by most of you, at least on the low tier, improves. Please do that. And there are many examples, but again, I'm going to stop here because of paucity of time, and I'm going to move forward with my presentation. So then we can have question and answers as well. So the summary of this presentation is, that generative AI has the potential to revolutionize clinical decision making and to improve health outcomes. But you need to understand that you do not need to blindly rely on the AI generated content, because ultimately you will be held responsible. You have to understand the capabilities and limitations of AI tools and proactively learn and implement the use of AI tools, because this is a change that is already here in this world and in your country as well. And at the end of the day, while you're using this AI tool, never ever forget what makes a good doctor and a healthcare professional. Someone who listens to the patient, who shows empathy, performs a clinical examination, has an eye contact, and is genuinely interested in the person sitting in front of him or her. The way forward is, alone we can do so little, together we can do so much. If you really want to integrate and improve AI uptake in Pakistan, it's not a one person's job, it's not a one organization's job, it's a teamwork. Obviously, at least in this country, you have to involve your federal and provincial health ministries, Pakistan Medical Dental Council, CPSP, the largest degree awarding postgraduate system in Pakistan, professional bodies, different organizations, and obviously APPNA can take a leadership role in this. And please never forget that whenever you are integrating any tool on patient, you have to involve the patients as well. मुझे पता पाकिस्तान में इसका ट्रेंड नहीं है मरीजों से पूछने का, बट यकीन करें मरीज भी इंसान होते हैं, कई दफा आपको आपसे बेहतर बात बता देते हैं. Now, this is a framework that has been recommended to integrate AI tool in a large system. First is acceptance and adoption. Yes, I agree. Many senior people are not very comfortable in accepting and adopting AI tools, but the world is changing and you have to change as well. Then you have to provide data and resources. It's going to be data intensive. It's going to be resource intensive. It's going to take a certain cost. Then you have to do the technical integration of your existing systems with the AI tools that are rapidly coming up. And obviously you have to have a governance model, an ethical framework, which should be contextual to your own country, because the way healthcare system is delivered in Pakistan is different what is being delivered in Sweden, Japan, Australia, and some other country. So we have to have our own local governance of AI tools in Pakistan. The take-home message is AI tools are not going to replace humans, but humans with AI skills will replace humans without AI skills. And for youngsters and even for people in my age group, the senior lot, do not wait. The time will never be just right. These AI tools are evolving on a daily basis. Start where you stand and work with whatever AI tools you may have at your disposal and command. And better AI tools will be found as you go along. And it does not matter how many resources you have. If you don't know how to use them, it will never be enough. I would stop here and request you please to give me a feedback on my presentation. My next workshop that I'm going to do is going to be a crash course next week. And then I'm going to do a couple of other workshops as well. And if you are interested, you might want to sign up from this link. So this is my LinkedIn profile, my email. So if now there are any questions, I'll be happy to answer them. I still have one more thing to demonstrate. So if there's time, I'll take 1 or 2 minutes and I'll demonstrate that. So thank you very much. If there are any questions, I'm happy to answer them.
Thank you so much, Dr. FAROOQ. That was an excellent, excellent presentation and very well attended. And there's a lot of questions. So I think we'll skip the comments from the moderators, and I will ask our moderator, Dr. Javeen, to please filter out some of the questions, and maybe we can have some Please go
Yeah,
ahead, Javeen.
like I think there is a comment that we may not confuse the AI supported solution with teleconsultation or telemedicine. But yes, what I have noticed that you can incorporate AI and make them work those platform better. But I will go to FAROOQ if we want to add on something.
I totally agree. Telemedicine is something different. But as you have just mentioned, Dr. Jameen, AI tools are being integrated in telemedicine as well. So, I mean, it's a
Yes.
very good combination of both. So, I mean, I strongly recommend that. I mean, telemedicine is actually being done mostly, again, by these smart tools, by these smartphones and laptop and computer which are connected to the internet. So why not to smartly integrate these AI tools in telemedicine in order to enhance the diagnostics or maybe to improve the healthcare delivery? So this is something that we should be talking about.
Yeah. The other question is, should we start thinking about updating our curriculum to include AI education as one of the subject for not only the learners, but also for the faculty members in colleges and universities?
I totally support this thing because this change has to come from the grassroots level and we have to make it a formal part of our education. But again, having said that, I would strongly recommend and request everyone, you need to understand as a healthcare professional, we have to involve in a self-directed learning. Just because my organization or my teacher is not teaching me anything is not an excuse for me not to learn that thing. There are so many resources available. So if it becomes part of curriculum, I would love that. I would support that. But till the time that's not reality, I would say please self-directed learning and learn it on your own.
Thank you, FAROOQ. Dr. Uzair and Zafar, there's a lot of inquiries about the APPNA conference. So if we can share it, I know Dr. Uzair has shared in the chat, but if we can share it in the WhatsApp group. Also, Dr. Ali Imran has got a lot of suggestions and lot to add. And thank you so much, Dr. Ali Imran, for sharing about your AI related work. And definitely APPNA will be happy to connect. And Dr. Ali Imran has a question as well. AI and social media can help in public health education, safety. Like, what are your thoughts, FAROOQ, about the safety and legal issues? And also, I think mostly the focus is safety and legal issues, basically.
Again, safety and legal issues are a major concern right now with the use of AI tools. And at least in context of Pakistan, unfortunately, we don't have a legal framework to the best of my knowledge. So many countries, at least in the Europe, Northern America, even in India, they're working on that. So first of all, we need to have our own local legal framework. But again, having said that, I just told you, till the time that is not available, it's our responsibility to educate ourselves, be agents of change, and in whatever capacity we are working as a teacher, as a student, maybe as a researcher, as an HOD, or maybe as an associate, we should be actually actively improving the knowledge about AI tools because one day this revolution is going to even come to Pakistan. This is how it happens in every country. I mean, technology seeps in developing countries at a later stage, but it does seep in. So till the time that governance or ethical framework is not available, we should actually educate ourselves in order to become thought leaders on this process.
Yeah, there's a loads and loads of question, but we will forward it to you and you can answer them separately. I'm just taking the last question, which is by Noorbat, and she's asking that how can we make sure that the AI predictions are accurate? How can the accuracy of the input can be checked? Because her feeling is it may be dangerous if we are getting an AI output which is inaccurate, especially if we are asking some sensitive information or putting in data for some sensitive result. So what are your thoughts about it, FAROOQ?
I agree. And again, it all connects back to the ethical and other concerns Because if you're putting in a patient's data, you must have clear consent of the patient that I'm going to use your data and put that data in an AI tool. I know this is not a common trend in Pakistan because यहाँ तो लोगों की तस्वीरें लेके आप अपलोड कर देते हैं, लोग पूरी पूरी सर्जरियों की अपलोड without even asking, और अगर कोई कहे कि it was wrong तो लोग नाराज होते हैं. अच्छा मैंने इसको ऑपरेशन किया था भाई, ऑपरेशन किया था, एहसान नहीं किया था, and you don't मतलब be a medical photographer. So this is a major concern. Or again, it all comes back to if you have a very good legal ethical framework, it's going to मतलब, work for you. But till the time it is not there, you need to understand that even AI tool makers clearly state AI can hallucinate. And yes, AI does hallucinate. It does make many mistakes. So one way of checking is to keep your knowledge updated. Do not totally rely on AI tools. Simply use it as your sort of like co-worker on which you can rely on putting in some burden. But main responsibility and the main clinical examination and finding would still remain with the main clinical patient, the person who is treating the patient. So if you have this kind of synergy, so probably the accuracy goes up. But this concern is still there that these are black boxes. How do they make decision? It's not very clear. Yes, they do make sometimes they make blunders, mistakes. So it's important for the physician or healthcare professional to be vigilant and cross-check, cross-reference in order to get to a real answer.
Let me allow me, Dr. Jabin, to comment by Professor Mulazim Bukhari. He's asking what tool we can use as a diagnostic tools in pathology. Do you have anything on your top of your head, Dr. Rathore?
I can tell one of my colleagues, she's in JSMU, she's a associate professor for pathology, and her a PhD dissertation is on using AI on digital pathology. So if Dr. Musalim is interested, I can connect, and she has done developing the whole model that how digital pathology can be like AI can revamp or enhance the utilization of digital pathology. So yes, there are models, there are diagnostic tools, and people are using it, and not in North America, but right in Pakistan.
Yeah. Along with that, I could just add one comment that as most of you know, there are languages that are other than ChatGPT, there is a Perplexity, there is a Claude, and these are the languages, and they have their different analytical analytical resources. Like a ChatGPT is quite analytical as compared to Perplexity and Claude. Claude is more humane in nature in terms of doing things, and they are more up to date. While as you all know that there are a lot of AI tools going every single day. Maybe currently, if I say with a cautious that maybe more than 5,000 AI tools are available in the market. And on a daily basis, 10 to 20 AI tools are introducing into the market. So you have to do some research where you can find the tool which is going to help you for your research. So with that, I think we are approached this our time of 12 o'clock, or we are at the dot now. So I will let Sarfraz.
I just want to add one thing, like
Please.
for any emerging new technology, we have to embrace it. But there's always guardrails that we have to put at our limitation, that what we are going to use and where are our boundaries. And everybody has their own boundaries that they have to set and then keep on exploring. We cannot hide away and shy away for not using them, but then keep on using and learning about them, having the right amount of guardrail placed, and then continue exploring. Like literally we are using it like Copilot with the teams for generating meeting minutes to generating action items, and the meeting minutes that we used to generate in 2 to 3 hours, now in few minutes that are generated. So I'm just giving you a simple case example. Yes, there are many far away utilization, but they are very low, near to you, low hanging fruits, which you can start exploring, and then you will know more about it and may use it in a more informed fashion. Thank you so much for allowing me to have my last comment.
Thank you so much. And I think a lot of people were interested in getting your email contact, Dr. Farooq Rathore. I think you put it in the chat. So, and in your last slide, there was an email. So if somebody would like to connect with you offline, they can certainly do that. And I think you hold series of seminars and lectures for people to join also. So definitely, there's a lot of interest. This is something that we'll see more of, and perhaps we'll ask you to come again with another iteration of your talk. Dr. Rosaire, do you have any comments? I know you've been listening quietly, but before we end, if there is something from your side.
So big thanks particularly to Dr. FAROOQ Rathore. I know how busy was he. He was moving and relocating to Quetta. So that where there's a will, there's a way. So the disturbed internet and everything, and he had many solutions. I really salute and love Dr. FAROOQ Rathore for his passion, and really grateful to all the participants for their very warm participation, and the panelists with having the keen interest of Dr. FAROOQ. You really rejuvenate our webinar. Now people are very much interactive, so you put everything into practice. Really, thank you very much indeed, and to all the participants, and over to Dr. Sarfraz.
Okay, thank you so much. Again, thank you to the panelists, Dr. Farooq, but I think we also must thank Waleed and his team for the technical assistance that they provide in the background to make sure that these webinars go smoothly. As I said in the outset, that this is the last for this year, and then please be on the lookout for the new series of webinars starting next year, and we'll be providing a summary of what we have done for the 3 years. Thank you to all the participants for joining. I know it's late in the hour in Pakistan, and it's a weekend. So thanks to everyone for joining, and thank you for everyone for their comments. And inshallah, we'll come again next year. Until then, please take care, stay well, and Happy New Year to all of you.
Thank you. Khuda Hafiz. Assalamu alaikum.
Hafiz.
Khuda Hafiz.
Thank you.